Now we'll discuss about the blood supply of the pelvic region. As we have already discussed that the aorta at the level of L4 divides into two common iliac arteries, and the common iliac arteries further divide into internal and external iliac arteries. Now, first we'll get to know about the cutaneous arterial supply of abdomen. You can see that the internal thoracic artery, which is a branch of subclavian artery, divides terminally into two branches, musculopharynx and superior epigastric. Now, the musculopharynx gives some anterior intercostal arteries. These are all that are discussed already in the thorax region. Then you can see the external iliac artery, which gives a branch that is inferior epigastric. It anastomoses with the superior epigastric artery. They are cremasteric, cutaneous, muscular pubic branches. Then further, you can see that the external iliac below the level of inguinal ligament is called femoral artery, which gives the only we'll discuss the cutaneous branches. These are the superficial epigastric, circumflex iliac, and external pudendal. External pudendal will supply the reproductive organs, and the superficial epigastric supplies here at the abdomen. This is all about the external iliac we have to discuss. Now comes the internal iliac artery. Internal iliac artery will divide into two branches, anterior and posterior branches. First, the posterior branch, its branches will supply the sacroiliac joint. These are the superior gluteal, iliolumbar, and lateral sacral. Now you must remember there was also a median sacral branch which supplies the anorectal junction, and all these three branches will supply the sacroiliac joint. Now we'll come towards the anterior branch of internal iliac artery. As you can see, it will give us superior vesicle, inferior gluteal, obturator, uterine artery, middle rectal, internal pudendal. We have already discussed the middle rectal. It also which will supply the muscular coat of rectum and anus. I'm repeating. And now we'll came toward this region. This is a male urinary bladder and structures attached. You can see this one is the vas deferens. This is the ureter. This is the seminal vesicle. This is the prostate gland. This hole is the urinary bladder, and this is the urethra. Now we'll discuss the superior vesical artery will supply the vas deferens and the bladder, and you can see the inferior vesical artery. It basically supplies all the structures here. You can see it supplies the bladder, it supplies the ureter, it supplies the seminal vesicle, it supplies the prostate, but it don't supply the vas deferens. Vas deferens is supplied by superior vesicle. Now we have discussed both vesical arteries. Now come the inferior gluteal. We have discussed the superior gluteal in posterior branch. The inferior gluteal will supply the bladder, the seminal vesicle, and the prostate. And then comes the obturator. Obturator will also supply the prostate. It will also give some pubic branches. And then the middle rectal, once we have discussed it, supply one branch, it will supply the muscular coat. The other branch, it will supply the ureter, prostate, and here we'll discuss it later. Now this was all about the male system. You can see that the vas deferens supply only by superior vesicle. The urinary bladder is supplied superior and inferior vesicle both, and you can see the ureter is supplied by middle rectal, inferior vesicle, and the uterine artery. In females it also supply ureter. We'll discuss it in later. And then it was the seminal vesicle. Seminal vesicle is supplied by the inferior gluteal and inferior vesicle. And then the prostate, it is supplied by almost every artery, like inferior vesicle, obturator, inferior gluteal, middle rectal. Okay, and now we'll move toward the female. As we've already discussed, the gonadal artery in female, it supplies the ovaries, fallopian tubes, and this uterus. The uterine artery, which is a branch of internal iliac artery, anterior branch, it come here you can see here there is a ureter in females, so it curves above the ureter. It also supplies the uterus, the vagina, the fallopian tubes. It also anastomoses with the gonadal artery or ovarian arteries in female, you can say. And then Vagina is supplied by the middle rectal and the inferior vesical artery that was in males. It forms the vaginal artery in females. And a part of it is also supplied by the uterine artery. So we have done with it. So we came to know about that the internal iliac artery has the anterior branch has the following branches. There is superior vesicle, inferior gluteal, obturator, and inferior vesicle forms the vaginal artery in females, and a middle rectal artery, and an additional artery in female, that is the uterine artery. Now it was all about internal iliac. The major branch that is now left is the internal pudendal artery. It is also branch of anterior branch of internal iliac artery. It passes through greater sciatic foramen, gluteal region, and the lesser sciatic foramen to enter in the pudendal canal. In the pudendal canal, it gives the inferior rectal artery. Inferior rectal artery supplies the rectum and is below the level of pectinate line. So above it was supplied by superior rectal, below it is pectinate, below pectinate line is supplied by inferior rectal, and the muscular coat is supplied by the middle rectal, and the anorectal junction is supplied by the median sacral. We have already discussed this. Okay, so the next branch, after passing through the pudendal canal, it gives the deep dorsal artery to bulb of penis, to urethra, and artery. Yes, this is one, and the testis and epididymis, that was originally supplied by the gonadal arteries. We have already discussed in the branches of abdominal aorta. Then comes the uh, transverse perineal and posterior scrotal and labial. Posterior scrotal and labial will supply the scrotum in males and the labia majora in females. And the leftover branch is the external pudendal. This is the internal pudendal artery, no? The external pudendal, so that was the branch of external iliac artery. This is the external pudendal, will also supply the reproductive organs. We've discussed the cutaneous supply. This was all about the blood supply of pelvis. If you have any query, you can ask.